Today I'd like to discuss the 3 errors of medicine. Error number 1, go back a century or 2. There were no diagnosis, right? There's no diagnostic tools, x-rays, MRIs. There was no real understanding of what health or disease was. If something appeared to be wrong, they did everything they could, including praying to spirits and whatnot, to try to heal the body. Certainly herbs or rest or sunlight and time and prayer were about what we had. So then came the era of modern medicine. What we grew up knowing is error number 2. Error number 2 was the treatment of symptoms, right? So it wasn't about restoring health, wasn't really about looking at causes. It was more based on what is considered evidence-based medicine. So we then had a group of specialists arrive. So we had a doctor for just the stomach and a doctor for just the ears, nose, and throat, and on and on. And so now we're all segmented and we're still treating symptoms for acute crisis intervention. See, but most people now don't get sick of things like they got sick of 200 or 300 years ago, right? Infection. And in fact, the historical research shows us that it was more about stable foods and cleaner sanitation than any medication that help us function and heal and not get sick in the first place. But if you did, antibiotics were certainly a wonderful tool to help that. But here's the problem, and has become the current challenge, which is why era 3 has been coming on for the last 15 years or so and become more mainstream as time goes on. But so era 2 was more about, so let's assume your immune system was weakened and you were sick. So the doctor might prescribe an antibiotic, amoxicillin or something, penicillin, to help fight the germ. The question is, what did they do to raise your body's resistance? Nothing. Much like in today's environment with a joint replacement, right? They go right for the surgery. We use cortisone still, which we've known for over 15 years, accelerates the arthritis. We use a gel shot, even though we know it's meant for a very early stage, but not so good for middle to late stage of osteoarthritis. And then we go right into a joint replacement. Now, again, it's amazing that we can do a joint replacement, but the downside is it's a 50-50. Half do very well and half just simply don't. They still have pain of a 4 to a 6th every day. They can't fully move or extend their joint. They're not allowed to kneel down or climb ladders again. So there are certain deficits that come with that treatment approach. There are certainly things that can be done, and this is what era 3 medicine does. This is what the Vinton Method was founded upon. This is what we've been doing for the past 37 years. This is why we've called together groups of physicians of different specialties and surgeons and chiropractors and pain management and neurologists and internal medicine to look at the whole person, not individual pieces, and each one doesn't know what the other one is doing, and each one doesn't look at the whole, because sometimes simple facts get missed by treating only individual parts and not looking at the whole. By having the best of era 2, but also the best of era 3 medicine, the Vinton Method really is the next level of medicine that we'll see more and more of as we have over the past 30 years until it becomes the new standard in medicine. It's already beginning to change. Patients are already beginning to ask those questions. Sure, we've treated the symptom, but what have we done to raise my vitality? Sure, we've extended maybe my life, but the quality is not that good. How do I improve the quality of my life as well as extend it? So it's the joining of all of those, and it's the phase of personalized medicine. What you might need might be significantly different than somebody else with similar symptoms, because your lifestyle might be different. There might be other factors or ages or whatever is involved. So that's what the Vinton Method does. We are truly era 3 medicine. We are ahead of the curve. We are one of the top clinics in the country. Era 3 medicine looks at the whole person, looks at a broader range of things so we can determine How are you functioning? So that we can then determine what's coming down the pike. It's not a mystery. Where's this train likely to end up? And how do we get out in front and lay down some new tracks so that we can avert that tragedy from happening, so that we can add life to your years and years to your life?